Hi, everybody. So last night we were talking about the STEMI, and I told you guys I was going to come back on and kind of go into that a little bit further. So the STEMI is ST elevation to myocardial infarction. This is when the artery is completely blocked. In STEMI, which is a non-STEMI, is ST elevation myocardial infarction. This is when the artery is partially blocked. Okay, ST refers to the ST segment on an ECG or EKG. Remember, we were talking about that last night. If a patient comes in with a STEMI and it converts to a non-STEMI, code it as a STEMI. Okay? If the STEMI involves into a non-STEMI, code the STEMI. Don't use the non-STEMI code. Okay, and these are some of the things and some of the notes that I had for years that are in this phone. They kind of transfer over. Okay, so just be careful about it. Okay, it may be on your test, so just I would take notes and write it down. Okay. If a patient had one, then had another one, you code both the STEMI and the non-STEMI. Because the non-STEMI is partial, okay? The code, the sequence is based on the circumstance. Read the notes before you do it. When I say read the notes, I'm talking about the cases. If this is the patient was smoking, go ahead and code the tobacco code, okay? And again, that's cardiovascular. That has to do with your arteries and your arteries being blocked. So, so I didn't tell you this. The initial specified as acute with a duration of 28 days or less. So if it lasts 28 days or less, we're considering that as initial. Okay, subsequent is having an MI within 4 weeks, regardless of the site. I did that kind of fast, but when you go in the classroom, we're going to go slow with that because I only have a few minutes to do this. So basically, that's pretty much what it is. And I'm uploading videos all the time. Not necessarily just the videos that I personally am doing, I'm uploading other people's videos because when you study, you have to get insight from other people's views as well, especially those cases. When I send you those videos that have to do with cases that are going on, no, you're not going to be a surgeon, but on your exam, AAPC wants to know, do you understand these surgeries? If you're not clear on how the surgeries are done, you're not going to pass that test. So, like the one we did last night, they want to know what a myocardial infarction is. They want to know, what a, retraction is. They're not going to say how you do the case step by step. When you start reading the cases, it's literally how the videos are done. They're just going to want to know how you code it. So that's why we, upload the videos. So I'm going to upload more videos so you guys can get a good understanding of it. And that's how, that's how you study. When you're home, that's how you study. When you're at work, that's how you study. Upload a video on your YouTube. There's thousands of them out there. And they will help you with your tests. Again, don't overload yourself with the study. Just do an hour, 2 hours a day, or when you can, and you'll be able to retain it better. That's what the videos are for you to retain the information. Now, in the class sessions, again, we're going to go step by step with the different chapters and, how things are coded and how we're going to do it and what might be on the exam. There might be stuff on the exam that you already know anyway, and some of you have already taken that exam, you're just taking it again. So just kind of be precarious of those things that are on there. And that's just to follow up on the STEMI that I actually had. And generally, in the phone, in my phone I have 1,000 things. And that's what I was telling you guys. When you put stuff down, this is pretty much most of the chapters. Wherever I'm at, I can pretty much open up this phone and kind of study what I want or look at what I want. Human immunodeficiency virus, chapter 13, diabetes, heart, cardiovascular. I have so much stuff in here, it's ridiculous. You don't have no glasses on, so forget about me just straight reading it. Okay, but that's what I want you guys to do, heart. And cardiovascular, that's one of my favorites. But I have all those things in here. Medical terminology, that's in here. Diabetes, that's in here. Anesthesia, that's in here. So, I would, recommend you do that as well, just, for a study basis to make sure that you got it. It's going to take a while. Again, my sessions are 10 weeks. So some of you guys that are beginners, we're going to go pretty much step by step, as beginners in that. So just take your time in doing it, and make sure you have notes, make sure you have books, make sure you have index, make sure you have stickies, whatever you need, because you're going to need to study in a way that is convenient for you. If you forget something, just pull up a video on YouTube. They have it. A lot of the girls and women that are on there, they've got some good, coding classes. And they go, let's say they're going through integumentary. They're going from first page to last page. And they'll tell you about the integumentary. What you will need to know is just kind of give the understanding of how the CPT book is. The CPT book is where the procedures are. You need to get an understanding of how to read the guidelines in there, because you can't code without knowing what the guidelines are. You don't have time to do that on your exam. So it's best that you kind of get comfortable with those guidelines before you go into your test. Every chapter has a guideline. Just read it, get to know it, so you're not reading that when you're doing your exam. Of course, you might need to kind of skim it when you do your exam, but you don't have time to sit there and kind of go over the guidelines while you've only got a minimal amount of time to do your test. That's why I suggest you do the easy questions first. The videos that I am showing you, that are on different surgeries and different cases, they help you with your open and closed cases. When I say, not cases, open and closed questions, what is the female organs? How many organs are in a female uterus, or whatever? If I send you a video on a vagina, then or a stomach, a uterus, or female, they want to know what's in there. So that's the purpose of the video. Write down what's in there. Just like vaginitis and all this other kind of stuff, vaginals. There's one that sounds like it's just for women, but there's another one, vaginalis or something, is for men. So that's why the videos are important for you guys to look at. Again, the videos will be uploaded in the sessions in the classroom. So those of you who are looking at them in the classroom, that's fine. You guys can look at them in there. When I post one in the classroom, more than likely it's going to be private from YouTube, because those videos are going to be like an hour or 2 hour long. And it's basically, that's how we're going to do the lectures. When you want a one-on-one, just let me know, and then we can kind of schedule that. But for now, just kind of, get that STEMI on card, get it on index card, look it up, get more in depth. You guys know I'm not going to go more in depth word for word. I'm just going to shoot it out there, and I'm giving you what you need, and you got to run with it. You know what I'm saying? So if I put you in this spot, you got to run with it. I'm not going to hold your hand and say, do this. I'm not going to do that. I'm putting you in the right place so that you can get what you need to pass the exam. Okay? You have to run with it. It's you who have to do it. So everything that you need to get you on the right track, to get you there, will have to get you there. Okay? So that's pretty much what this video is about. I'll have other stuff probably the weekend. Today I'm pretty much off, but I'm going back to work tomorrow. So you guys, I won't be on probably again until Saturday or Sunday or something like that. And we'll talk about stuff like that as far as the videos and how you're going to retain information from the videos. Did you guys get that cabbage off pump? So remember, that pump is used when the heart is completely stopped. The heart in the video I gave you last night was not completely stopped, so that's why they did not use it. And I put the, like the animated videos, because the regular videos are kind of hard. Some people can't look at that stuff. I mean, you could ask my sister. She see that stuff every day. My sister is right there in the OR doing those cases with those surgeons. So she can tell you word for word, how invasive it is and what it really, really looks like. You know what I'm saying? I'm going on the terminology and what we are reading and what we are studying. But you can ask my sister about any type of surgery there is. She has been in on those surgeries right there with the surgeon. So that's her profession. She's certified to do that, and I I can't do that. All them years ago when me and her started, we used to do that stuff. Man, I can't. I got to go. I got to go to another profession. And a lot of people say, "Gosh, you and Wendy, me and Wendy worked in so many jobs together. It's ridiculous." And we started out. I remember we worked at Bethpage, and we were CNAs years ago. I probably was like 19 or something, and I fell asleep in the bathroom, and Wendy was looking for me all over the place. But me and Wendy go way back on stuff that we did. We used to work in Long Island Jewish, and we were on the floor, and when people pass away, they do de-age, and we had a patient, and boy, he was hollering out, and everybody be like, "Oh, that's him again, and like 5 minutes later, we didn't hear him, and that was Wendy's side of the floor, and I had the other side of the floor. Wendy wouldn't go in there, but she had to go in there, so she come and got me, and we went in there, and the man was gone, he was gone, but the man de-aged like 10 years. We were like, wow. And of course, we had to wrap them, but, Wendy kind of, stayed in that type of profession. So, I'm not saying send her, they ask everything, but she's been on all those, surgeries that we are talking about, and she knows how invasive they are. So, the PAD videos, I did find two that I wanted to put on. I did put those on last night, so you guys can go ahead and look at it. And also, if you guys have couple of issues that you want to just look at, I'll find you a video and throw it up on my Facebook. I do have my Sapphire Financial Business page. I'm on there, but I just find myself on my regular Facebook all the time. So some of you guys that are reaching out to me, and I just don't know who you are, I haven't befriended you yet, I will. Sometimes, I'm a little precarious about who's getting on my page, just, let me know. I'll shoot a video, out there. Somebody sent me something on IBS and IBD, but we went over that a while ago, but I can, I can put something up on that. And a good friend of mine, he has PTSD, and he's fine, but you would never know it if you didn't hear him talk. When he talks, he's loud, but that's from all those bombs going off and stuff like that. I mean, he was military 30 years, so, I can put something up on that, but I don't remember anything about PTSD being on the chest. But they may ask you. I think ESTD or something like that. That's early childhood. That's on there. They're going to ask you what that ESTD, whatever it is. I'm going to go through that in the classroom. But those are some of the things that they ask you. What is it? They might say what PTSD is. Post-traumatic syndrome. They may say that. So just be precarious to that. Integumentary system. They're going to go through that. That's a long segment. They do 2 hours on that, and then I have to have stuff in the classroom on that. You're going to be a while doing that. When we get to those cases, it's going to be something. So, but you guys are gonna like that case. A lot of y'all got the question right about the kid with the coin in his throat, which is fine. That's pretty good. But again, that has to do with the medical terminology. You get the wrong answer if you don't know what the medical terminology is. So I'll still, I'm going to throw stuff out there like that. But a lot of that comes from the quizzes that are in the classroom. So, last night I did throw something out there. Those of you who email me about the sessions, if you email me before tonight at 5, you guys can go ahead and take the class for nothing and print out whatever you want. So that's the ability that you have in the classroom. You can print out what you want. The quizzes and whatever else, you can still, you can print those things out, the videos and all that stuff you can also print out. So again, the classes are based on you passing your coding exam. The NHA exam I threw out there. Look on the website, see what it's all about. And don't forget, my book is Medical Billing and Coding Q&A. The book is about beginners, letting you know what billing and coding is about. So I do suggest you get that book. If you do join the classroom, the book comes with the classroom, so you don't have to buy the book if you are joining the classroom. That book comes with it. But if you just want to buy the book and just kind of see what the classes are about, the book is $20 on my site. I took it down 52%, and it's $40 on Amazon. But again, you guys just let me know what you want to do, and we'll try to get it done. The classes will not start until April 4th. That's when the classes will start. We are still uploading in the new 220 class, so just, kind of be precarious about that. And remember, coding is a lot of fun, and again, you got to do something that's your passion to do. I mean, we eat and sleep coding. I'm telling you, when you have a passion to do something, you wake up and you're going to figure out, how am I going to do that? And, you have your girls, they calling you, Lise, Trina called me about, how this happened, how that happened. I don't know. If we got codes that we're not sure of, we got to check it out because you can't send it over. You know what I'm saying? If you don't know, you got to query the doctor. Always remember that. You got to query the doctor. And some of you guys, you can start with billing first if you choose to, instead of going into coding. But if you want to dive into the coding, you can. You just have to be taught step by step. How to do the code. And remember, the ICD-10 guidelines must be read. I had to read them like 5 times. Cause I'm like, I don't know. If I don't know something, I got to be like, okay, what you say? What? It's not comprehensible to me. So, if I'm not really clear on something, I can't fold with it. I can't, I know I ain't going to deal with it. So I ask questions over and over. If I read something and I'm not deciphering it right, I just keep reading it and reading until I get it. You know what I'm saying? If you have a case that you just don't understand, let me tell you something, the cardiovascular case, the heart case, this is crazy because I don't understand why AAPC needs to know how the circulation is done, how the process is done. And I'm talking about, they want to know what goes first. How does that heart circulation go? What do we do? The cleaning first, deoxygenated, oxygenated? They want to know this in a circle. And you're going to have a multiple choice question of how that thing goes down. Listen, it is what it is. You know what I'm saying? It is what it is. And that's how you challenge yourself. When they give you these crazy questions and you're like, what? That's how you challenge yourself because I'm telling you, you will be so happy after you do it. And you get it right, you go, okay. And that's why I like to look at a lot of cardiology too, because sometimes I have to go over it, with my students, a lot of times, because it ain't comprehensible. One of my students, she just, that's something hard to get, because if you keep in your mind, why do they need this, why do they need that, don't keep that in your mind. Just do it. Just do it. Get it done. Retain it and do it. I'm 17 minutes in. I do this all the time. So just kind of be precarious about stuff like that, and that's what we're here for. We're here for you to pass your test and do what you need to do. I would write down some of those women who do they do coding stuff, or they might give you like insight and stuff like that. I can't think of none of their names, but you'll see them in it. You type in code and they go word for word. I'm not really sure what the objective is of those coding YouTube. Like ours is a study guide to teach you to pass your CPC, but they have a lot of nice coding sessions. Like you could type in anesthesia, you can type in cardiology, and they'll pull out their CPT book and they read, and that's good because that's like a study thing. You could go word for word with them, and you can still ask them. You can still ask them questions and stuff like that. The one I like, I haven't seen her in a while, but I'm gonna turn her on. She was talking about something with somebody she had hired for her, and they didn't like the pay or something she was giving them. But you can't think of it like that. When somebody hires you as a coder and you're coming in as an apprentice is somebody who has no experience, just coming into coding, no schooling, just training. You might have took like our class, like a boot camp type of thing. If you've done something like that and you haven't been coding, you call an apprentice. And some people would bring you in and put them under their wing and they looking out for you. She might have been given $20 an hour or something, and she just didn't like it. But you can't think of it like that. If she giving you $20 an hour, I don't give you $15 an hour, $10. You still being educated. You still being educated. To me, being educated for nothing. Like if I go here and I do a couple hours here and I'm going to this hospital or whatever hospital or whatever, I think about it as me being educated. They paying me to educate me. So that's how you got to look at it. You know what I'm saying? Look at it as a next step. Now, this girl was an apprentice coming in and working for her. And, of course, it didn't work out. She left or whatever. But, you still have to have that, hometown. Listen, this is what it is. Don't don't sugarcoat nothing, because I have girls work for me doing the billing. Think of it as a educational process. If I'm giving you $10 an hour, think of the rest as educational process. I'm your teacher for life, and that's how I am. Even my students now, they already know that I'm their teacher for life. They can call me about anything I show you, anything I teach you. If I take you under my wing, I'm taking you under my wing for life. So if I give you $10 an hour, that's all I got to give you right now because I'm still teaching you. You know what I'm saying? When you become experienced in what you need to do, you be my right hand. I could send you over here and then you straight. I don't have to worry about this or I don't have to go behind you. But, again, all of it is a teaching process. It's a teaching process. So, that's the deal on that. Okay, so again, this is a study channel. That's what we do. I will have other videos uploaded in the session, but they won't be videos like this. The videos like this, I'll probably drop these and transfer them over there. But these are like informational videos for anybody who is taking a test or taking an exam and just trying to advance themselves. And I know the books are a lot of money. I don't know. I might do like a GoFundMe book type of thing. I don't know. I asked Shanika how to do that. My sister Shanika, y'all know my sister Shanika. I had to ask her how to do that kind of thing. She's done something like that for one of her friends or girlfriends or something like that. She's done like a GoFundMe kind of thing. I don't know how to do it, but I might have to do something like that for you guys for the books. The books, you're talking about over $1,000. I ain't gonna lie. The books is a lot of money. And I'm trying to eliminate some where I have the books and how I can kind of teach you guys with my books that I have. But you still got to have the books. You guys got to have the books. I'm saying if you can't get them, you guys just let me know where I'll figure out how to get them. And, again, if you're home, you're watching TV and you're just trying to figure out what you're trying to do, you need to shout at Miss Lambert because I don't want you sitting at home on the couch. I don't want you sitting there watching TV. You know what I'm saying? I want you to be doing something. I don't care if you read a page a day on billing. Somebody gonna open the door for you. Somebody gonna open the door for you. You just got to know what you're doing. Because a lot of times, even in billing, they give you a little 25, question test. You can pass it. You can pass it. Get the book. Get the billing and code and Q&A book. What's in there is what's on entry level test when you become a biller. That's what's in there. Okay. So, a lot of that is, it's different levels. You have clerks, representatives, specialists, team leaders, coordinators, supervisors, managers, directors. Depend on your level of education, that's the level your title should be. Now, okay, you do have some places that, they drop titles on people and, just drop titles on them when, you classified as a specialist, but they don't, threw a coordinator name on you. You're doing coordinator work and, you're really a specialist. But I don't think of it like that. I think of it as training. I think of it as training. I don't care. Take to, coordinators and the supervisors, you doing directorship work or managership work. So what? When you get ready to get up there, you'll have that experience already. So that's pretty much the scenario with that. I just wanted to kind of sit in front of the window today. This is the patio back there. I don't know if y'all can see the mountains back there, but I can't really see that much light going on back there. But, I wanted to kind of have you guys look at a different view other than my little tiny office in there. So, I don't know. Me and my sister going to hit that downstairs. Well, it's going to be 60 degrees today. When she comes in from work, we might do something with downstairs. And I don't know, I might make a little area down there or something like that. We'll see. We got all kind of stuff downstairs in the basement. It's not really a basement, it's like a split level thing that we can do stuff with. But when it get warm, we usually kind of go down there and kind of hang out. But I don't know. But this is pretty good. But I just want to kind of touch bases on that. Next time I will have different things out so that I could show you certain stuff, but it's kind of hard for me to show you on this video. I don't know how my grandsons do like this whole thing on their phones. I have no idea. I don't know how to do it. My little one, he's 8 years old, but he knows how to do all this stuff with his phone and he sees everything. But don't worry about that. Just as long as you can hear me and you can visualize, that's fine. I'm 24 minutes in. I'm going to clock out of here in 25 minutes. So we got 15 seconds. But anyway, get the STEMI, replay it over and over and over. If you cannot get the book, let me know if you can't get the CPC book. I don't know how we work that out, but I'm gonna do a GoFundMe thing for y'all. I don't know. Y'all send me an email. Tell me how we gonna name it. Facebook, GoFundMe, CPT books. I don't know, but if we need help to jump that off, we need help to jump that off. I'm working on the letter for the grant, so I don't know. We'll see. But nothing's overnight. Nothing takes overnight. It might be a minute, before we do those things. Because years ago when I first started doing the coding business, it was diamond coding and billing, and I didn't do none of that stuff. I just kind of did my business without YouTube and Twitter and all that kind of stuff. But now we got all these things. My grandson is like, "Grandma, you should do so and so." So, I'm not afraid, but it takes time to do these things. So again, check out the other videos and look at all my videos and just see what you like, see what you want to pick. Let me know what you guys want to talk about. I've gotten back to most of you guys' emails, but again, watch your study. Watch your study. Don't study too long. Don't study 8 hours, 6 hours, and cram all that stuff in there because you're gonna forget it. Some of us have long-term memory. Some of us have short-term memory. So just be precarious of that. Okay, I'm gonna see you next time.